which is, I think, another piece of that IFS model, right, is like you developed this at a time when it was needed and it kept you safe, and we love and we honor and we can be grateful and appreciate that. And I think that actually, I can say all that, but that actually is a really hard task, just to appreciate the things that are happening right now that were keeping you safe then. But maybe you're saying, gosh, I don't want that to continue right now. And then you're able to consider, well, what would something else be after you're able to honor and appreciate, like, this part is keeping you safe.
Welcome again to the MVP podcast. I'm Aaron Leo. I'm one of the therapists here, and I'm here with my good friend and colleague, Maria. Maria, I'm going to let you introduce yourself and tell folks a little bit about you.
Amazing. Yes. Hi, I'm Maria Dischinger. I'm a therapist also at MVP, and been there for a few years now, and have just loved getting to be there, love being there, period, love what I get to do, love who I work with, colleagues and client-wise. And so I, like I said, I'm a therapist. I kind of work with all ages, I say, as young as 5 or 6, all the way up through 75 plus, we'll say, even higher. So, love what I get to do. We're kind of with a gamut of different things, anything from anxiety, depression, to trauma and abuse, and to more psychosis-based disorders, to schizophrenia. And so I love what I get to do for work. And I would say really my bread and butter, what I love to work with, is trauma and abuse. And so that's broadly a little bit about my therapy practice and what I love to do with it.
Awesome. Tell us a little bit of how you got into the field and your background, and what got you into this work?
Yeah, so I am from the Chicagoland area originally, and grew up there, went to school there, thought I wanted to do something healthcare, medically oriented for probably like most of my life up and through college, and thought I was going to do something in a hospital setting. Wasn't necessarily looking at mental health, was thinking more physical therapy or PA or something. And just as I progressed through my program, I, by the end, realized how much I didn't want to do something that was so like physically oriented, that I didn't love that. But what I did love, really enjoyed, and was looking for, was that connection and that relationship and the emotional support that I could offer patients. And so that translated really well then to, well, why am I not looking at something more psychology, mental, emotional health adjacent or related? Thought for a little bit about, do I want to do more the psychology route? Ultimately came to the place of, no, I really just want to sit down with people and journey with them through the things that life brings and throws towards them as they sit in that, and just the I think like the privilege it is to sit with people in some of those like deepest pains and biggest wins, and then honestly mostly everything in between those, right? Because that's majority of our experiences. And so that set my trajectory, went on my way to a mental health clinical mental health master's program, and really set the stage, and knew through and through from there that just as my experiences continued, I loved this. This is what I love to do. I love sitting with people. I love and really see it as such a privilege to get to sit in a room with them in such a vulnerable space and meet them in that, and hold space and hold them in that, and hopefully offer some healing and support in that too.
I love that, and feel very much the same way. So thank you for sharing the work you do.
Yeah.
You mentioned that trauma and abuse are kind of your specialties.
Yeah.
share with us a little bit about what you do there and your work with folks that have experienced trauma and abuse, or what that looks like.
Yeah. Yeah. Well, and so I also raise a, piece of context too. So between my undergrad and graduate education, I did some work, some nonprofit work with, it was like a migration education and trafficking awareness team, but mainly with, anti-trafficking is what we'll like summarize it as in Southeast Asia. Lived there for a bit and had some time to get to like really work hands-on in a lot of different facets, as often happens with nonprofit work, where you're kind of more a like plugging gaps wherever they need you is where they throw you. And that really it connected with my heart. There was a lot that and a lot of I wanted to be able to offer, but I knew I didn't have the education or the skill set to offer. And so I had that kind of primed in my mind going into grad school, and wasn't 100% sure, but through and through grad school firmed up more and more like this really is where I want to be sitting and what I want to be able to help with. And so my experience has again afforded that to be with people as young as 5 and 6 and as old as, like I said, 75 plus. And so that looks very different, working with trauma and abuse in those different stages of life. And there's so much that trauma and abuse encompasses. And so I think that, yeah, what drew me there and what I love to do, right, is to be able to offer like tangible relief, because there is so much pain and suffering that comes with that. And so one thing I knew pretty quickly was a modality I wanted to get training in was EMDR, which stands for eye movement desensitization and reprocessing therapy. That is a therapy that I have seen bring so much relief, and I love to use. That is probably one of like the biggest frameworks I will offer and talk about with clients. And then around the same time as that, I had a supervisor and some people I worked with who had some training and familiarity with a different modality called IFS, or internal family systems. And while I am not certified in that, I do incorporate that a lot as well into EMDR, or even just do that alone, and find that both of those tend to be very healing, very like practical, tangible things that we can do while just even creating, with the foundation of building that safe and secure relationship in that space where they feel like, oh, I can even consider going into that with you. So those are modalities I love to use with it. And it is I feel like it, like I've said, right? I've said it's a privilege quite a few times. And I also think there is some longevity and relationship building that are so central to healing from trauma and abuse that also mesh really well with my personality and my philosophy around therapy and healing.
Awesome. For folks who haven't heard of EMDR or IFS, can you just give us like your 2-minute spiel, what you tell clients when you're teaching them about it, and maybe talk a little bit about, if there's any like research behind it, or just help us know a little bit more about them.
Totally. I preface definitely when I talk about IFS, I say it's a little wonky, so I need you to be comfortable doing that with me here for a second. Is what I always start with people. My clients have definitely heard me use the word wonky when I talk about IFS. And that's what we talk about it as. So EMDR is a little bit less wonky, so I'll start there actually, because there is quite a bit of research behind it. It's not that new a modality, though I think it is newer, maybe in awareness to people. I should say like in the last 50, 60 years, it's come to be a modality. Big picture, right? EMDR eye movement desensitization reprocessing. The idea is that as we do what's called bilateral stimulation, which is either eye movement side to side or tapping side to side, something where basically you're stimulating, like going left to right or top corner to bottom corner of opposite sides. It helps your brain essentially resume reprocessing of traumas. And the idea being that when trauma happens, it really gets stuck in your brain. So you'll hear analogies like, think of a tape that's stuck and it's just looping, right? We're basically helping it unloop. Or if trauma is like a train left the station, but it got stuck on the track and it didn't make it to its endpoint, right? And that's why it keeps kind of living alive in the present in us, even though it's in the past. We are, by doing this bilateral stimulation and some of the structure of EMDR, it helps your brain move that to an adaptive end place. The idea being when trauma happens, we have sort of this life-threatening or like maladaptive is the term they use a lot, takeaway of, I am bad, I'm not safe, I don't have control, there's nothing I can do. Very I-rooted statements though. And the idea is how can we help move that memory along to a place, an adaptive place where then we can transform that towards like, I can have safety now, or I can create safety for myself, or I'm not bad, I'm good, right? Like some of these more like positive, true things about ourselves that aren't doing us harm. And so the idea is as we do this bilateral stimulation, we go through this structure with EMDR, we're allowed to process memories towards a place of less distress and not the same kind of maladaptive or negative or harmful message to ourselves often that we take away from trauma. I'll pause there. Any like confusion, questions about that?
Yeah. What I hear you saying is basically when something traumatic happens, we will get stuck, or a part of us will get stuck in that place, and we'll believe certain things about ourselves because of that.
Yeah.
And the EMDR helps us reprocess that so that we can turn maladaptive thoughts and feelings and beliefs into adaptive ones.
Yes.
Yeah, but would you add anything to that, or?
Well, I would. So actually, I love that you said a part of us, because I think that's actually why I see EMDR marry so well with IFS concepts language, because one big term you'll hear a lot when it comes, now switching to that other one, that other theory, that other modality, IFS, internal family systems, is this concept of parts. And so to answer your question before I jump there, yes, I think, in sum, right, exactly what you said. When trauma happens, part of our brain gets stuck there, and it also kind of runs wild with this idea, this message we take away from this life or death situation, whether it's emotional, physical, social, something is wrong with me, I did something wrong, I have no control or choices, I don't have safety, or I'm vulnerable, or I don't have belonging or connection. And so our goal is to basically address those messages we took away, help that trauma memory move towards that adaptive place where it's not as distressing, and also ultimately help heal some of those negative beliefs you took away about yourself.
Perfect.
Amazing.
What does that, like, could you give us an example of like a negative belief that turns into a positive one? Like, what would that look like, practically speaking?
Yeah, definitely. Like, one that I always think of is like, you might take away from a traumatic situation, there's something wrong with me, I am defective, or I am broken. And so we might work through that memory with the goal, part of that being, I would prefer, one of the questions we'll ask is, what would you prefer to believe about yourself, or prefer this memory say about you? And you might say, I hope that I wish that I could see, I'm not bad, or there's not something wrong with me. I'm good. I'm not defective. I'm whole. I'm not broken. I'm whole. Right. And so then part of that process will be even focusing on that idea of like, I am good as we actually think about that memory. But again, what I love about EMDR is there's a structure and there's a process to it. And so it's not like right off the bat, I'm going to be saying, I want you to think about this memory and think about I am good. And we're just going to sit here and hope that that clicks. There's a process to getting to that with that to me feels intuitive and intuitive as I walk someone through it, and timely, like it doesn't feel rushed or inappropriate at the time.
Right. I don't know if anyone knows the answer to this question, so feel free to tell me, but why do you think something will happen to someone and the automatic reaction is to believe something negative about self, right? Like, you know, it doesn't necessarily seem like that would have to be the case, but a very common tendency. So I'm just curious about why you think that happens.
Yeah. And I don't know if this is true, I'll acknowledge, but at least in my head, somewhere along the way, I think I heard someone say or read somewhere that, right, our brains are wired, you hear they're wired for connection, and also they're predominantly actually wired to keep you alive. Like your brain's number one goal is to try and keep you alive. And when you are, especially the younger you are, the more dependent you are on your primary caregivers or primary attachment figures, whoever is taking care of you, you're at their mercy, right? You're dependent totally on them to take care of you. And the idea is if there is an issue where they're not taking care of me, if it's my fault, like your brain is looking to take responsibility, because if you can take responsibility, then you have control to change it. And so I heard, like, at a very base level, it's evolutionarily or survival wise, a wiring for survival. If it's me, then I can do something to prevent this from happening again, and I can ensure that I will stay alive. And so I think that's why we do, and I think humans are obviously more complicated than that, but I think that's why, especially the younger you are, kind of even the more, not stuck, but like the stronger the more ingrained that is of like, it was my fault. When it definitely, we can look back and say like, it is not your fault. But as a kid, there's this just strong, like, I can't provide for myself. I am totally dependent on others to provide and take care of me to ensure my survival. So if it's my fault, then I can make sure I can still survive and I can prevent death, whatever that looks like.
Right. So you can adapt to any childhood experience or set of circumstances in order to survive, because we need other people to take care of us.
Yes. And I think there's a lot of compassion in that too. You can offer yourself and even that can be part of the, I think whether it's through EMDR or just as a larger takeaway is like, you did what you needed to survive. Like you are alive today, period. And that is like what your brain said was your number one task. And so you're here. And I think there's, a lot of compassion we can give ourselves in that.
Yeah, you're making me think about like a horse that is up and running around like an hour after it's born, right? Or like a monkey when they'll like right after they're born, they'll be like holding on to their mother.
Yes.
Because their only job is to do that so that they live.
Yes.
Right?
Yep. Yes.
And our job as babies and small children is to adapt to what our caregivers are doing and how they're behaving and all of that, because we need them to survive.
Yes, absolutely.
Which obviously in an ideal scenario that looks like a healthy, happy environment, but for a lot of people it's anything but. So.
Yeah. Yeah, it creates it creates a lot of opportunity to take responsibility that isn't yours. But that at that age and at that time, right, it's like you can't conceptualize or even consider that in your developing brain. And so then there's almost this, like, as your brain is developing, if you have situations that tell you that in order to survive, this needs to happen or that needs to happen, or this is your fault, these things that risk your survival, those get stuck there. And that's where, a common refrain in EMDR training is the past is present or the past is alive. And that's where I think, you have people coming 20, 30, 50, 60, 40, 50, I'm not going to cut out the 40-year-olds, 40, 50, 60, all ages, still kind of stuck in this, why do I go to like, that was my fault? Or why do I get stuck in these responses that just feel mismatched or feel, another thing we'll talk about, like with IFS more, is maybe that doesn't feel like, I don't feel like myself or my age right now, right? Sometimes I'll ask, like, how old do you feel? How old does that part of you feel? And I'll have people say, like, oh, really young, like 5, 6, like I feel like really little when this is happening. And we can both sit there knowing you're not that old, but there's something inside of you that feels not fully just present in this moment.
Right. In that adaptation
Mm-hmm.
for your circumstances when you're young,
Mm-hmm.
obviously not so helpful as you get.
Yes, which is, I think, another piece of that IFS model, right? Is like, you developed this at a time when it was needed and it kept you safe, and we love and we honor and we can be grateful and appreciate that. And I think that actually, I can say all that, but that actually is a really hard task, just to appreciate the things that are happening right now that were keeping you safe then. But maybe you're saying, gosh, I don't want that to continue right now. And then you're able to consider, well, what would something else be, after you're able to honor and appreciate, like, this part is keeping you safe.
Right. Well, we're talking about IFS, so let's dig into it. Internal family systems. I agree. It sounds wonky.
Yep.
So, what do you tell people?
I tell people it's wonky because, so the wonkiest part is probably when I ask you to, like, visualize or imagine having a conversation with the part, right? And it can be, I think that can be like the biggest barrier hurdle, is when I say, like, even if I'm like, okay, I want you to imagine what this part of you looks like, or if I ask you to, like, focus in on the sensation, imagine if you could reach in, pull it out, and look at it in the palm of your hands, what would it look like? And now I want you to imagine that it talks, right? Like, kind of all these, like, very imaginative things that some people like connect with right away, and other people are not that visual, so we adapt for that. And other people, they're like, this feels crazy, like, I feel like, why you're having me talk to myself? And I'm like, well, I kind of am. But I want you to have I want us to have a conversation with this part of you. And that can be difficult, maybe initially, to get comfortable in, but once you're doing it, I find it's pretty easy to just kind of keep going.
And with, I think there's this idea out there, maybe from like movies or whatever popular media, about multiple personality disorder, or these other things. Like, how is this different from like having a split personality?
Yes, absolutely. So when we talk about currently, what was previously multiple personality disorder is called dissociative identity disorder. The idea is, you're consciously, right? Like, kind of consciously at the forefront, it's not fully you operating there. There's like a different personality persona that kind of shifts to that forefront. You can see gaps in memory, or, some of the common experiences could be like, don't recognize myself in the mirror when I look at myself. And so it's that to me, and there's this piece of like, it's not really within your control. What we're talking about here, I actually all the time will preface IFS with, have you seen the movie Inside Out? And if not, right, most people are somewhat familiar. And even if not, I'll say, okay, I'm going to give you a brief, right? It's this kid. She's got in her brain these core emotions, and they each play their own roles, and they're all kind of running wild in there. Like, let's take that concept, and I want you to imagine that you have different, not purely like emotional parts. Like your parts aren't going to necessarily be like anger, joy, jealousy, but in the sense that there are these little people kind of running around inside of you, whether we want to say it's younger versions of you, or different protector, which we'll kind of get into that language and that structure in a minute. Essentially, they're little people running around inside of you, and I feel like that's a good kind of place to start. And that I always say is very different than DID, dissociative identity disorder, where there isn't this sense of we're choosing to engage with these.
Right. And I think we can all identify with the feeling or sensation of acting in a way that seems different from
Yes.
how we would want to be or how we think of ourselves. Like, why am I doing this right now? I don't even know what I'm doing.
Yes.
I think we intuitively get that.
Mm-hmm.
But it can be complicated and painful for people.
Totally. And and I'll ask people, like, have you ever had an experience where you are talking with somebody and you're like, this isn't me, or this isn't really just about them, or I don't feel like I'm just talking to them, right? And that to me is like, there's something more going on there than just like you having a conversation. Something emotionally has been activated, something trauma-wise has maybe been activated. And so that's where then I say, like, okay, let's focus on like, what did that feel like? What did the sensation feel like? Can we follow that in? Or like pull that out and look at that. And I'll ask all sorts of questions about a sensation or a part. And like, there are ways that will basically flesh out and get to know this part of you and what it does to ultimately keep you safe, or what role it serves to you.
I think it's helpful for me and hopefully for others too, to hear that kind of fleshed out, like what that looks like. So you can pick a case or just something that you see frequently where you would, what that would look like, what you would do, and where are you trying to get?
Yeah. So, okay, great question. Well, okay, I'll give an example. I'll give the broad overview and like maybe an example with it then, right? So broad overview, IFS, internal family systems, is a theory, the idea being that for the system outside of you, the external system that you operate in, and by system, we can be talking about family, we can be talking about your family of origin, the family you're in right now, even like social spheres, right? For all of what goes on outside of there, there's like kind of a mirrored or matched system that goes on inside of you as well. So if you are in a family system where like maybe there's a really high standard that really fosters perfectionism, or you live in a lot of fear of somebody getting really angry with you and doing something wrong, right? There are parts there, and you'll hear the word parts a lot. The idea is there's like a mirrored version of that inside of you as well. And so the way that I maybe like visualize this is, right, when you're born into this world, there's like core you, and the theory will say, the core you is curious and not afraid and maybe very free is kind of this idea, right? Creative. It's like who you are at your core before you've experienced any pains, any woundings, any hurts. And then as we go throughout the course of life and that system develops and we experience pain and hurt, we develop our own version of protectors, right? So someone might hurt us by saying, we don't want you in this friend right? We think you're weird. We don't really like you, right? And so you might develop this very critical, highly critical protector within yourself that you don't even realize at times. It's that voice that kind of pops up in social situations now and says, "Oh my gosh, you're so weird," or "You're like you need to really be careful how you dress and show up." You're right. This hypercritical, sensitive to rejection, always on the lookout for that protector who's doing its best to keep you safe by preventing further rejection, further hurt, right? That wounded that core you. Now you've got this protector who maybe counterintuitively is trying to keep you safe from rejection by being really critical to you, repeating what someone did to you. And so we have all sorts of types of protectors that we develop. There might be one who plays the same role, like showed up in multiple different woundings, right? It might be like, well, that protector shows up not just the time my friends rejected me, but also like when I felt like my family rejected me or when I felt like somebody broke up with me, right? Like that same protector kind of got stronger because it was like, look, if you had just been better, if we had been on the lookout or on alert, it might be extra critical and be saying if we could have just known blank, then we could have prevented the rejection and that pain. And so there are all sorts of types of protectors that you can develop. And sometimes we'll go over, like I have a document of like 60 types of example protectors. And we'll just walk through them and talk about like, do any of these resonate with you? And so then procedurally, or what do we do with that, right? We try and get to know the protectors. We try and develop an understanding and a gratitude and a relationship really with them. Because I mean, ultimately, right, our goal is for those to soften because they're still alive and well today doing their things, sometimes in spaces we don't want them to. Not many of us are sitting here saying, I love being criticized by myself. I love how much I criticize myself. Not many of us really do feel that way. And so to develop a love and an understanding and a relationship with that part, and to then be able to ask it, can you soften in these situations? Like, I see you, I hear you, I know your job is to help prevent rejection because rejection really hurts. And also, like, maybe we can handle the rejection. Can we handle the rejection today? Or can we understand today that if somebody rejects us, like, it doesn't have to mean blank, right? Like, basically trying to connect who you are now and that protector part to all that you've experienced in hopes that we can transform its role, soften what it's doing, ultimately have less of that self-critical voice going on in your head, and ultimately be more vulnerable and like congruent and in the world and yourself, all those things.
Right. And if just using that example, if we are so critical of ourselves, we might not take the necessary risks with other people to have truly intimate and vulnerable relationships with others because it requires a great deal of risk.
Yeah. Or I'll even say too, you might notice like, gosh, why am I so critical of my partner or my kids or my friend? And friends are a bit different, but like, especially those, like, as you get kind of that closer circle of like, why do I, without realizing it, I'm actually often really critical of my partner, my kids, or hold them to a really high standard. And I think that can bring a lot of shame or a lot of like, gosh, I must be a terrible person, right? Almost that additional criticism, that compounded criticism. And so to be able to give yourself understanding and compassion of like, you're doing this not just because there's something unhealed in you, but because this is how you learned to keep yourself safe. You also probably see this as keeping them safe, actually, on some level of if you don't mess up, if you can be perfect, if we can all be perfect, then we never have to worry about rejection. And it's like, well, what if there was a way to not have to be perfect and to not have to live with that criticism for yourself and those you love, to be softened in that way, to be able to handle rejection, to look like, what would it look like to actually deal probably at the core with the trauma of that rejection and what that meant to you about you.
Right. And that gets back to not only the IFS, but also the EMDR and working through those events that can get us stuck.
Yes. And so I actually love IFS too. I mean, I love both back and forth to bounce between them, right? But I love what IFS does too. So EMDR can be very like it doesn't have to, but commonly the idea with EMDR is like we're picking a trauma, like a memory, something, an event. And what I love with IFS is we're not necessarily focusing on a singular event. We get to also say like this part maybe started, right? One of the pieces we might talk about is when did this protector come to be? How far back can you remember it coming to exist? But like that has been present every time. And so I love that there's almost this like, especially for people who are like, there's too many memories, or that feels too scary to start with one singular memory. Like it can be a softer kind of like easing in, like, okay, well, we don't have to start with a specific memory. We can start with the part, and then maybe all three of us, me, you, and the part, right, can talk about like, would EMDR around this memory actually be appropriate or helpful, or what would it look like to come to a place where we can help heal the part, and if there is a significant trauma memory.
Right. And you use that kind of core self to help you navigate, maybe there are times when it is really important to be critical of someone because they're a dangerous person, right?
Yeah.
It's such a tricky dynamic to navigate because those things are there for a reason.
Totally. It's almost this question of like, how do I feel like, how can I create safety for myself and maybe like also maintain some level of vigilance, but not hypervigilance. Especially when I feel like I've been hurt or burned. I feel like that is like often a bigger question too, right, with clients of like, what does it mean to live like in our world where we are right now, where we are woundable. And that's actually, I mean, we could get into a whole thing where like that actually is when it gets really interesting to talk about Brené Brown's stuff on vulnerability and woundability and what it means to like being in connection means we are open to wounding. Does that mean that we have to just say like, okay, do whatever you want to me, world? Like, no, that's not what I'm talking about either. But I think that's when it gets to that core of like, what's not hypervigilance, what's not lack of care for self, what's that like, what does it look like to live it with awareness and in honoring what you've been through while still trying to have some openness to connection in the world, if that's what we're wanting.
Right. And I guess the idea is until you've examined those parts and those adaptations and whatever is no longer serving you well, you won't know.
And I think that's actually right. So you then also develop this relationship with that core you, which really I would say is the you that holds all of those wounds, right? And so that's why we can talk about that from like a inner self to like to an inner child, to like different ages where those wounds happened, and ultimately like tending to this wounding within yourself. I think we start there because then once that has been we start there after we started with the protectors, but we start there before we talk about relationship with other people, because that I feel like has to, if I can sit with my hurt within myself and learn to hold that, then I can consider what does it look like to still allow others in who might hurt me, who could hurt me. I can't promise to that wounded self like that we won't get hurt again. And so in a lot of ways I'm saying like, can you trust me to like do my best? And at the same time, like we can't control what others will do, which is really scary when you have trauma and abuse, right? There's this idea of like, well, then is it worth it, right? And it really comes down to like, if I can start with myself, then maybe I can start to consider that with somebody else.
Right. And if you can bring healing and love and care to yourself, and something in the future happens, you'll be able to do it again. You'll be able to heal again.
Yeah.
So you can take those risks knowing that you can get better.
Yes. And I think that's what it really, right, kind of like a not uncommon concept that will come up in therapy is, what is our capacity to hold our hurt and pain in a world where like there is no guarantee or no way to prevent that unless you are completely alone. And even then, I would say you're actually still in pain because now you've cut yourself off from connection. And so,
Right.
what does it mean, not just conceptually, belief wise, but like experientially, to know like I am in relationship with people who could hurt me, who have hurt me, or I've had relationship with people who have hurt me. How do I have really, I want, or I desire, or I need, ultimately want relationship again, and I've been hurt, and so how do I do that?
Right. Yeah.
Yeah.
It's powerful stuff. Any other elements of EMDR or IFS that you feel are important to touch on here today?
I think in terms of like conceptually, feel like I gave a snapshot and a little more details into each. Maybe the only other thing I would tell people, and maybe this doesn't need to be spoken, or maybe people assume it, but I'll still say it, right? Like both of those processes can be lengthier, right? And so it's not going to be necessarily like a therapy modality where you say, I'm going to come in for so many weeks and we're going to focus on hitting this. Or as structured as I said EMDR is, there's also this piece of like, it takes as long as it takes to move through each phase. Now, I hope people don't hear that and think like, oh my gosh, does that mean like it's going to be years of EMDR? That's not what it means either. I think sometimes maybe people come in thinking like, I'm going to come in and do it 3 to 6 solid sessions. We'll get it done and I'll get it out. And it's not that that can't happen. I just, in my experience, it isn't often like that. Though I have seen it like that, it's not often like that. And maybe that's assumed because we're talking about trauma and abuse, but maybe it's not. So I feel like kind of setting that expectation of it, it can just take a bit of time.
Yeah. Healing happens at its own rate. You can't really make it go faster or slower. It just kind of happens.
Yeah, it's not a shortcut to healing would be the other thing too. It's still a healing process. Yeah,
just you remind me of like breaking a bone, right? It heals over time. If you push it too hard too fast, then you just wind up doing damage.
Yeah, and wind up prolonging the healing too. Right now it's actually like, well, if I just like stuck it through for 8 weeks or whatever versus I tried to shortcut it, and now suddenly we're doing a 16-week recovery actually from beginning to this.
Well, it was so fun getting to connect. I always like to wrap these up by saying, what is something I should have asked you about or could have asked you about and I didn't? Or anything you'd just like to share with folks?
Oh, that's a great, I don't know. We could have talked about new hobby ideas. That is recently on my mind. Like, what is a good new hobby to get into? Someone asked me recently, what are your hobbies? And I was like, I don't know.
You're like, what are hobbies?
Yeah. Well, I was like, I do this or I do that, but I'm like, I need like I read books, but like something fun to do. So I was like, maybe, I don't know, could have talked about some fun, slow, maybe self-care oriented things.
I think a hobby has to be fun, right?
Yes.
Otherwise you don't do it. That's my only advice. Got to be something fun.
Yeah.
But we're also unique. It's impossible to know.
Yep. Yes. Well, and part of what came to my mind, or I was thinking when you said that, was I'm realizing I want to challenge myself to be more enjoying of the journey. And so finding a hobby where I can enjoy the process and not just the end product.
I like it.
Yes.
I like that. Well, I'll keep brainstorming with you.
Yes. Thank you. Perfect.
Thanks for taking the time, Maria.
Thank you. Thank you for taking the time to want to pick my brain.
Of course. All right. You take care.
Thanks. You too.